angioplasty is done normally in a blood vessel which is blocked between 50 to 75%. If it is blocked more than that, and if it is nearing total block, then angioplasty becomes difficult, because while doing angioplasty, we put in a small thin hair-like metal wire. We call it as guide wire. And even if sometimes the guide wire also cannot be passed through the block, we are unable to do a plasty. Let us know more about what is angiogram and what is angioplasty. I am Dr. Muralidhar. Friends, now let us know more about what is angiogram and what is angioplasty. See, an angiogram is nothing but injecting something into the blood vessel, which we call as a contrast or a dye, and the blood which is flowing within the blood vessel gets mixed with this chemical. And then when you take an X-ray or a photo, you can see the blood vessel. And that is how the pattern of blood vessel can be seen or visualized using this angiogram, because the blood gets mixed with this radioopaque contrast. So there are various chemicals, or there are many which we use, and when we inject, they are very safe. They mix with blood vessels and the blood vessel becomes radioopaque. And by doing this, what we can achieve? We can know what is the inside of the blood vessel, whether it is smooth or whether it is rough, or whether there are any blocks, and if at all, if there are blocks, what are the percentages of blocks, whether it is 25% block or a 75% block or a 98% block. So we can know. And earlier when we were doing such angiograms, we were directly putting a needle into the blood vessel or into the artery and then injecting this dye and doing an angiogram. This we used to call as a DSA, that is called Digital Subtraction Angiogram. But it used to be a little invasive, because we have to puncture an artery and then inject, and that puncture hole sometimes will give rise to bleeding, and the bleeding can be sometimes more due to various reasons, like if the patient is having problem and is taking an anticoagulation, the bleeding can be more, and there will be a hematoma at the place where we have punctured the artery, and this hematoma will become a big problem later on. And we have also operated on these hematomas. So to avoid all this, slowly another type of angiogram came into picture, that is called MR angiogram. MR means Magnetic Resonance Angiogram. In this, what we do, we inject a chemical into the vein, like we give IV drips. So like that, we inject a dye into the vein that gets mixed with the whole body blood, and then wherever we want, we can take pictures and accurately we can map the blood vessels of the entire body. This is a very huge advancement in the technology of doing angiogram. So MR angiograms are very, very handy, and they can be done by giving intravenous chemical injection. So now by doing this, we can know where exactly is the block. So now if we are studying the leg and we hope or we expect there is a block in the thigh artery, then we can concentrate on that portion and then get an angiogram of the blood vessels which are running in the thigh. And now once we diagnose that there is a block, then we can plan what type of treatment the patient should be given. If it is a 100% block, a long block where there is no point in trying or attempting to do a plasty, we have to take the patient for surgery. What type of surgery? It's called bypass surgery. What is this bypass? The bypass is nothing but by putting an artificial route to make the blood flow from proximal to the block to the distal to the block. So this is called a bypass surgery, and for which we can use the native vein which is available within the patient, Or we can also use an artificial tube which we call as a graft. And now the grafts are of various chemicals. Now we have a PTFE grafts. What is PTFE? Polytetrafluoroethylene. PTFE, which is a very inert substance, and using this a tube is made, and that tube we get at whatever diameter we want, 7 millimeter, 8 millimeter, whatever. And then we also get bifurcated grafts, and then we get a long graft, 40 centimeter grafts, or a 70 centimeter graft, or a 1 meter 100 centimeter grafts. And many times if the graft has to be used across a joint, and then the graft gets kinked and the blood may not flow at that place, so we have grafts called ringed grafts. So a ring is placed around the graft so that even if the graft gets bent when it is inside the body or when it is near the joint, even then the graft won't be blocked. So these are all the techniques or the technology which has advanced in terms of manufacture of the grafts. Now coming to the angioplasty. Now when we do angioplasty, we do sometimes only a ballooning, so that we open up the blood vessel and leave it. But many times we have seen when we open up, it opens up. But after some time, maybe after a week or a month, it gets blocked again. So to prevent this, we put a stent. That stent keeps the blood vessel open, and for a long time, this patency of the blood vessel is maintained. So now we should know, when do we do angioplasty? The angioplasty is done normally in a blood vessel which is blocked between 50 to 75%. If it is blocked more than that, and if it is nearing total block, then angioplasty becomes difficult, because while doing angioplasty, we put in a small thin hair-like metal wire. We call it as guide wire. And even if sometimes the guide wire also cannot be passed through the block, we are unable to do a plasty. At least we should be able to pass the guide wire, and over the guide wire we pass a balloon, and over the balloon we also place a stent. Then it is possible to do angioplasty, because it's a less invasive procedure than doing a bypass or a surgery. So we always prefer to do an angioplasty. And in case if the angioplasty is not successful, we always have an option of doing bypass. So this is in brief about both angiogram, angioplasty, bypass.